Hey, Kennedy.
Hi.
Great to see you.
You too.
So tell me a little bit about why you're here, what your concerns are, and what you tried for them.
Yeah, for sure. So, I mean, obviously my biggest concern is going to be my double chin area. Truthfully, it's when I look in the mirror, it's the first thing I see. And pictures, that's a big one for me. Like pictures, it's the first thing I notice. And a lot of the times, like if I'm wanting to post it on social media, it keeps me from posting it just because I'm that self-conscious about it.
Yeah.
My weight's always fluctuated throughout my life. So I've been smaller and it's still been there. It's still been the problem. So, there really isn't anything that I've done that's gotten rid of it. So,
Yeah. So what kinds of things have you looked at? Have you learned about any procedures? Have you thought about surgery? Anything like that?
Really for me, it was kind of not a lot of downtime. I can't really afford a lot of downtime. So, I've done my research of the body contouring and things like that. But there just hasn't really been anything that I've found that's checked all my boxes, I guess, up until this point.
So you found FaceTite
Yes.
as a possible solution.
Mm-hmm.
I know Miranda's talked to you a little bit about that.
Mm-hmm.
So tell me what you know about FaceTite so far so I can answer questions for you.
Yeah, so Miranda was fantastic. She, kind of told me what to expect, before, during, and after. Non-invasive, she said, so minimal downtime, which really piqued my interest. Just because with work and things like that, and around the holidays, I can't afford to be out long. Mm-hmm. So, and then just seeing before and after photos, your works.
Yeah.
You're good at what you do, so that was a big thing.
We enjoy making people happy, that's for sure.
Yeah.
So, like you said, a lot of patients really enjoy this procedure. I enjoy it because it allows people like you who are very busy to get something done. It's minimally invasive. What we're doing is we're using radio frequency energy that is able to melt fat and tighten skin. And we can do that under local anesthetic, meaning you're not put to sleep.
Okay.
So you stay awake. You're very comfortable during the process, and then the recovery really itself is just really a few days of wearing some compression.
That's awesome.
So, were there any other questions that you had about the procedure itself that were of concern to you?
Really, kind of pain wise, kind of does it hurt? Kind of what that just the unknown of not really knowing what to expect in terms of how that works.
That's a great question. Pain we really can control well. We use a technique where we're using the special local anesthetic, and that local anesthetic is put in and around all the fat that we're going to work on. So the fat is put to sleep. Okay. That's the first step in the process, and we allow for all the time necessary, for you to get good anesthetic.
Okay.
So really no concerns about pain. That particular numb feeling will last at least for the first 24-hour period.
Okay.
So you'll go home and you really shouldn't get home and then have a lot of pain or soreness.
Okay.
The next day, when we take off your compression, hopefully we'll see that the anesthetic itself has kept you from bruising, that you've stayed pretty comfortable. You might be sore day 2, day 3 a little bit, but most people go right back to their typical days.
Awesome.
So we do ask that you're not going to do anything strenuous during the recovery period of just really about a week.
Okay. That's awesome.
We're just allowing your body to heal.
Right, absolutely.
Yeah, so not much pain.
Okay, awesome.